Well, the specific challenges in Africa are the resources. So we are still using the old way of oxygen delivery. So the challenge is very clear resources, and even if there are this equipment, materials are available, human resource who have adequate skill and knowledge on this equipment is lacking. So the challenge is really huge, but hopefully we are trying to narrow the challenge that we have, but the challenge is tremendous. In Africa, parents' involvement is very much limited. I remember times when mom and dad are trying to see their dying babies through the window, and it's really heartbreaking. The way we doctors are trying to prevent them from coming in close contact to their children, to their babies, is really, for me, is heartbreaking. And I know that mom is the closest person to the babies. We doctors, it makes me emotional that we prevent them not to see their dying babies, sick babies. I always advocate for having mom together with the doctors and nurses to be with the child, with a preterm baby or with term baby or any sick baby. I always tell to my students and also to colleagues that we should never prevent parents. We did a study in my unit a long time ago. The presence of mothers in the unit is a value in saving life. So if the mothers are in the unit, the chance of that baby to survive is high. The chance of dying is less when compared to situation where the mothers are not around. So I will say, I hope, it's my also hope, that we will come to understanding of involving parents in the care of children and babies. Now it's a very clear movement also in Europe, are involving the mothers in the care of a baby, which is the right direction. So I think it's not far when we understand this and involve parents in the care of their children. Kangaroo mother care, which I actually introduced to Ethiopia after studying in it from Colombia 2 decades back, is one way of proof that presence of mothers and keeping the baby with the mother will really have impact on survival. And people also showed on not only survival, but also development, the brain development, intellectual development, and will improve when the mothers are there with the babies. So I think this is an area that really needs to look into and improve. My wish as a neonatologist is to see all babies born to be alive. I don't want to see babies born to die, just to die. I wish them to survive, not only survival, but thrive, also have a potential of their development and contribute to the country's future, because the country's future, given country's future depends on today's newborn.